States are looking to follow the lead of Colorado to limit freedom of choice and religion for healthcare sharing ministry members. Many Christians nationwide are opting for healthcare sharing over traditional insurance. And here to set us straight on what is happening and why is Katy Talento. She's Executive Director of the Alliance of Healthcare Sharing Ministries. Katy, it's good to talk with you again. So please explain for our viewers, how is Colorado jeopardizing choice and religious freedom for healthcare sharing members?
Hi, Gary. Thank you so much for having me. Yes, Colorado passed an unfortunate piece of legislation last year that would require an incredible amount of intrusive and burdensome reporting from healthcare sharing ministries that we fear could chill our efforts to operate in the state. So let me give you an example. They required us to disclose all of our contracted vendors. That includes healthcare providers, doctors, nurses that work with us. In this age of the cancel culture, people don't want their names reported to the government and then put out on a website by that government. But that's exactly what this bill would allow. And we're very nervous about it. We're still waiting to see exactly how it's going to be implemented. Our ministries have started the reporting. They're reporting as much as they can, but they're certainly not going to report anything that's unconstitutional or impossible for them to report. So we're nervously watching this situation.
Well, knowing this, why then are other state legislatures considering similar legislation to that of Colorado?
I think that when you have legislators that are worried about what is best for consumers, and they think that misplaced good intentions, they think they know what's best. And they've decided that the Affordable Care Act plans on the Obamacare marketplaces are the best choice for people. That's what they've decided. And, they can't put themselves necessarily in the shoes of a Christian believer who's trying to find a healthcare solution that's much more like what we think Jesus would do, how we think Jesus would do healthcare.
When you served as White House health advisor, you exposed the corrupt business practices of some pharmacy benefit managers. Who are they? What are they doing? And how does that affect our pocketbooks in healthcare?
Yes. So pharmacy benefit managers are this type of company that's sort of a shadowy middleman between your insurance company and you. And really, they set up the drug formularies on every insurance policy, and they are basically operating a pay-to-play operation. So you have a pharmaceutical company and you make a drug, and that pharmacy benefit manager comes to you and says, "Nice drug you have there. It'd be a shame if nobody could get access to it." And they charge a kickback, a legalized kickback that would otherwise be illegal in healthcare. But Congress gave an exemption to this weird industry. And so they charge this kickback from the pharmaceutical manufacturers, the drug makers. And they say, if you don't pay us the biggest kickback, then we won't put your drug on the formulary for everyone's insurance policy. And so what the drug companies do is they say, okay, we'll give you a bigger kickback, but we can't really afford to just eat the cost of that. So we're going to keep raising our list price so that we can afford to give a bigger kickback to these middlemen. These companies no one had ever heard about 20 years ago. Now they're on the Fortune 100 list. They're massive profiteers, and they're starting to eat up insurance companies. That's how big they are. They're eating Cigna. They're eating Aetna. They're eating Blue Cross plans. So these companies have said, you know what? We're going to jump into bed with them. We want a piece of that action because they're so profitable. They're far more profitable than the insurance companies. So they merge, and then you have no downward pressure on prices at all.
Okay, Katy Talento, good talking with you again. Thank you for setting us straight today. We appreciate it.
Thank you, Gary.